And then someone commented on the forces of willpower and the hunger hormone, which I thought was brilliant. Good morning, beautiful people. This is Mama Goob checking in again with you to discuss my experiences with the vertical sleeve gastrectomy in hopes that it'll help you make the best decision for yourself. So I was searching the internet the other night and I came across a subreddit based on the show My 600 Pound Life, which, as an aside, is one show that I thought was very helpful with me and my weight loss journey. And it's still helpful to me, I think, because it has a combination of inspiring me versus completely frustrating me. The original poster on the subreddit for My 600 Pound Life asked a question. They said, why, if so many patients are doing so well on Dr. Now's diet of 1,200 calories and low carb, why would they still want to get surgery? So I was reading through that and I thought it was really interesting. So I also stumbled upon a video on YouTube of a recent segment of 60 Minutes. It was discussing weight loss medicines and the focus was, well, they work, but insurance doesn't cover them. So why? So I actually think these two issues correspond together. First of all, the subredditor replying to the original poster actually had it right. This commenter said, are you willing to follow this heavy regimented diet for the rest of your life? A vast majority of people, okay, meaning all people, want to have normal foods for the rest of your life. There's no way that you can stay on a 1,200 calorie diet with very low carbs for anything more than, I'd say, a year or so. Then another commenter replied, and having a reduced stomach size forces the person to stop eating after they've had enough. The addiction to food just doesn't go away, but mindless eating can't happen anymore. And I think that that's also really true. And then someone commented on the forces of willpower and the hunger hormone, which I thought was brilliant. So this commenter replied, yeah, a lot of it is about sticking to it. Most people can do that diet for a few weeks, but if you have hundreds of pounds to lose, that's years of discipline to do it. Having it so you can't eat large amounts takes away willpower from the equation. And I fully believe in this. On the flip side, from the 60 Minutes segment, to contrast this, they discussed the weight loss injectable drug Wegovy and how basically insurance won't cover it and it costs about $1,300 a month if you don't have insurance. And they were discussing how unfair it is for the regular obese person, while superstars and rich people can afford this drug, it's out of reach for many people without insurance. So they were saying that the reason why insurance doesn't cover it is because it is not proven for long-term results and has a lot of side effects. But the doctor added, those side effects eventually do go away, and it's why they start them incrementally in small doses. But the medicine will have to be taken indefinitely.
The vast majority of people with obesity simply can't afford Wegovy, and most insurance companies refuse to cover it, partly because, as AHIP, the Health Insurance Trade Association, explained in a statement, these drugs have not yet been proven to work well for long-term weight management and can have complications and adverse impacts on patients.
This segment also discusses willpower, and it's a fallacy.
That's where the stigma of obesity comes in. The idea that the patient can do it with diet and exercise. You would never do that to a patient with hypertension or heart disease or type 2 diabetes. Tell them that you just don't eat sugar, you'll be fine. All those years of thinking that somehow you have no willpower and it's your moral failing and you're a glutton and why did you eat so much and feeling shame.
So my opinion is that the chronically obese person, if it was all just a matter of willpower, they would have never become chronically obese as it is. So they definitely do need some medical assistance to get down to a healthier weight. So to sum up, The debate on whether a drug is better or worse than a surgery boils down to how you feel about having to take a drug for the rest of your life versus having a healthy portion of your body removed. What I believe to be the optimal situation is using the drug in order to get the weight down to a safe level so that the surgery could be performed as quickly as possible, as a lot of these super morbidly obese, they need to lose weight like yesterday because they have very bad problems. They can't walk, they can't move. So anything to help them to get down as quick and easily as possible to the weight where surgery would be performed, in my mind, is the ultimate situation to happen. So not that I'm against Dr. Now's diet, but listen, a lot of that is for the show. If you watch the early episodes, he doesn't make them, prove it. But if you watch the original, like season 1, season 2 episodes, he basically doesn't make them show that they could, be on the diet. So I think it would solve a lot of the heartache and the angst for these patients if he wasn't so strict on this 1,200 calorie diet, because that's really hard. I don't even know if I could do that now, even after my surgery. But anyways, my surgeon employs that tactic. I didn't have to take the weight loss drug, but he said that, anybody where the surgery was going to be unhealthy, like where losing weight would help, he would give them the weight loss drug, get them down to a safe level, and then do surgery. To sum it up, although it's up to the individual to make the decision on which path is right for you, whether it be surgery or drugs, I really do feel like it's important to do something, as sheer willpower isn't just going to cut it for the long run. So I hope people watch this and decide to take my advice or take the advice of doctors and get healthy so you can live a long, happy, and prosperous life. Well, that's all I have for now. I thank you all for listening, and I hope you enjoy the rest of your day.